Hi, good evening. I'm Dr. Kelly Burkenstock. I own Skin Body Health, a medical and anti-aging clinic in both Mandeville and New Orleans, Louisiana. Actually, we service people around the United States as well, but our local offices are here in Louisiana. Tonight's topic is going to be a little bit of a mature topic. So I will begin to let you know you may want, if you have small children or children under 18, that you might not want to hear a mature topic. Perhaps tonight is a night that you may want to go into another area or have them go play. So tonight's topic is going to be on female dryness. Last week we talked about menopause and hormone replacement therapy and the changes in the hormones that happen to us as we age. The decrease in estrogen, testosterone, progesterone, and the whole cascade, which can lead to a multitude of symptoms, including but not limited to hot flashes, decreased libido, mood, decreased muscle mass, increased flab, and the all-toward topic for tonight, feminine dryness. So I'm going to be quite literal right now because I think that this helps describe and takes the embarrassment out of what's going on. So when we get vaginal or feminine atrophy, meaning a deterioration of the cells, then the lining of the vaginal canal, the feminine canal, start to deteriorate and become thin. And when that happens, it leads to a cascade of events, but they can be changed. So vaginal atrophy can occur at any age, mostly in perimenopause, the stages leading up to menopause, and throughout menopause. It's really started by a decrease in estrogen, a reduced estrogen production in the ovaries, and that can happen again during some ladies in earlier life, but most ladies in perimenopause, the time when their cycles start changing and they start entering the change, and then menopause and beyond. Estrogen is that hormone that's responsible for female sexual development, our menstrual cycles, as well as the whole development and production of eggs and being receptive to the sperm to then again reproduce and have babies. Estrogen also promotes bone and skin health. It is a fabulous hormone for cardiovascular as well as mind and brain balance. So without this hormone, we know that sometimes the heart can get in trouble, and a lot of times the brain can get very moody and depressed. So estrogen determines a lot about our brain activity and our mood. What's very interesting to me is that estrogen is very much followed by the moon. So if we think we're not all related creatures and related to nature, it brings you back to God and the elements, or the higher power and the elements. So most women, when it becomes time for a full moon, will begin to build up their estrogen to get ready for their cycle. And for women in menopause, it's very, very interesting. So if you can't make the same amounts of your estrogen that you did when you were younger, you can then, before the full moon and leading up to the full moon, if you will be catered to, whether that's going to a yoga class and having the instructor touch you and instruct you, which is very soothing, or whether it's a date with a partner, all of those things sort of raise your estrogen. So you can still vary with the moon and increase your estrogen naturally, even though you're menopausal. And that might sound a little woo-woo. Don't think I don't know that it sounds a little woo-woo, but there really is scientific research that backs these statements up. Since we know estrogen is so important to the female, and it is important to a male, but that's another talk for another day, and we will get to those talks. But right now we're on females, and we're on vaginal dryness. And the things that can reduce estrogen unnaturally that we don't want, that have untoward circumstances in our body, is contraceptives. So the pills or the injections that we take for birth control can really decrease our estrogen and send us on a slippery slope to other things that we weren't prepared for. So these early contraceptives in the young girls can often lead to premature atrophy or premature dryness in the vaginal canal, which is certainly not welcome. Breastfeeding and childbirth, lack of arousal before intercourse. So if someone is just not ready, there wasn't enough foreplay, or partner that there's an issue with, or anything, or perhaps just stress in someone's life where they're just not feeling that arousal or desire, that can also decrease your estrogen. Again, breastfeeding and childbirth. And then if you had a cancer and you're getting hormonal cancer treatments and no radiation treatments, it can reduce the estrogen and therefore the lubrication in the female areas of the body. Autoimmune disorders such as Sjogren's syndrome. Sjogren's is a disorder that, an autoimmune disorder that decreases the fluid producing in the glands. So not only it's the glands of the mouth, so they have dry mouth, dry eyes, and also dry feminine parts as well. So when we begin with this severe vaginal dryness, we can have symptoms such as, of course, dryness, discharge, could be with or without odor, decreased lubrication during intercourse, and then that can sometimes breed or roll over to partners thinking that one or the other is not, the chemistry is gone, the love is gone. And that's not the case. In fact, it can be from a hormonal disorder or an autoimmune disorder such as Sjogren's. Sometimes you'll have bleeding after intercourse when we're experiencing this vaginal atrophy, this degradation of the vaginal tissue and decrease in vaginal lubrication. Along with this is often seen frequent urinary tract infections, which are very miserable and untoward, and the person has to get on antibiotics and such, which is never a welcome venue. We want to avoid antibiotics at all costs. At the same time, urinary tract infections, if ignored, can smolder and become dangerous, not only that they're painful. It can also lead to a tightening and sort of a shortening of the vagina, so that in reality it becomes very, very uncomfortable. On a medical note, if you have the type of health that would allow for bioidentical hormones, you can insert some vaginal cream, estriol, which is estrogen 3 or E3, estriol, and it will absolutely rebuild the tissues if there are no contraindications to your health because of some other female condition. And that's a lovely thing, and it has no systemic, meaning all over body risk, because we're only inserting it into the part of the body that it will do health and some good. Of course, see your doctor before going on any sort of medical journey for this. So let's talk about what is offered to us for vaginal lubrication, because that's when we begin to get on a slippery slope. We know vaginal atrophy is inflammation, a dryness, and a thinning of the vaginal walls. There are some natural remedies, which I'll get into in a moment. What I want to emphasize tonight is that the things that are offered in the drugstores are not healthy. I would not offer them to a cow, much less a human. So there are a lot of personal lubricant jellies. And one name that we all know is KY jelly. Here's another generic off-brand of a personal lubricant. Well, what are in these personal lubricants? Are they safe, and should we be using them? And the answer is no, 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 and no. Why? Well, let's talk a little bit about that. Well, the first ingredient that you see on the label of these personal lubricants that you can get at the local drugstore is water and glycerin, typically. Water and glycerin, pretty harmless. Glycerin is a compound derived from vegetable oils or animal fats. No big deal. The next ingredient typically is hydroxyethyl cellulose or something similar. That's a thickening agent derived from cellulose. Cellulose is derived from plants. Still, not a big deal. Then it gets pretty interesting. The next ingredient, or they may be in different orders, so they may be using different amounts of these ingredients, but most of them contain chlorhexidine-gluconate. Well, without even being medical, you could hear that chlorhexidine-gluconate sounds like a pretty scary big word, and it is. It's a class of antimicrobials, and it works by decreasing the amount of bacteria. Okay? So if you're blocking bacteria, it's blocking good bacteria and it's blocking bad bacteria, which sets you up for bacterial vaginosis, which is you chasing the elephant, antibiotic after antibiotic, problem after problem. It's not a sexually transmitted disease, although it's treated like one, and it can be simply from these weird lubricants that we're using, like KY, excuse me for beating up their brand. There's a million of them out there, whether they're in the adult stores, whether they're in drugstores, they all have these ingredients. Check your labels. Chlorhexidine gluconate is another ingredient I find often in these vaginal lubricants. Gluconolactone is a white crystalline powder derived from gluconic acid. It's an acid and it absolutely should not be in the vaginal canal. Methylparaben is in a lot of these products. Parabens are chemicals that are often used as preservatives to give products a longer shelf life. Well, I'm glad it gave you a longer shelf life, but it definitely doesn't need to be in our human bodies. It just sits there and it gets rancid. The last but not least, sodium hydroxide. Well, sodium hydroxide, listen clearly. That is a lye or a caustic soda that can be very irritating to mucous membranes and is very corrosive. If it's corrosive to machine equipment, would not it be corrosive to the human body? Ladies and gentlemen, we do not want this on our bodies. Well, if we can't use the lubricants that are in the drugstores, if you find favor with what I'm preaching, then what can we use? You're not going to believe. Nature has the perfect answer for us, and it's been under our nose the whole time. So, our natural remedies come in the form of raw coconut oil. Coconut oil. It's got a pH between 5 and 6.5. Our normal vaginal pH is a little bit lower, but some theories are that when coconut oil is heated up by the human body tissue, it actually decreases the pH and almost matches vaginal pH. You don't want to change a lot of the vaginal pH because that's when bacteria and such can enter. But it's amazing that coconut oil does so much good. Let me tell you a little bit about the benefits of coconut oil. Number one, it should be fresh and raw, which means raw. And because coconut oil has a high melting point, it can prevent friction during human relations better than water-based lubricants, as we were talking before, which have a tendency to dry up in reaction to body heat. So if they're drying up in reaction to body heat, they're causing issues and frictions in that vaginal canal, which is further worsening the problem. Coconut oil hydrates the skin and possibly the mucous membranes in the vaginal tissue. And it's got a pH balance that is so close to the ideal of the biome or the natural state of the vaginal area, so it's unlikely to disturb vaginal pH levels. Again, coconut oil, depending on the literature, 5.5 to 7, and the female area is 4.5 to 6. Again, it is thought when coconut oil is heated up that it in fact comes down, which is what we want it to do, to a little bit more acidic level. Maintaining the female biome or genre or balance in the vaginal area is key to our sexual health and definitely should be important when we're choosing an agent. So would not you want to use something that is natural and readily available rather than something that is full of preservatives and caustic lye acids such as sodium hydroxide in the human body? There are further studies that are needed, but at this point, I feel strong enough in being able to recommend that. There was a small study on coconut oil, and it was with 87 women. And in those 87 women, the combination of coconut oil and probiotics was shown to relieve the symptoms of vaginal atrophy. Probiotics are good bacteria and yeast that we take in to replace what we've lost through preserved foods, fast foods, xenoestrogens that are out, the pollution, and so on and so forth. So we have a product, pre-probiotics, and the pre-probiotics goes and tightens up that leaky gut and sends probiotics in its good form around the whole human body. It is shown to not only relieve symptoms of vaginal atrophy, but also urinary problems like urinary tract infections. Applying topical E3 estriol, either topically or internally, has been shown to be a great benefit for building that lining of the canal. So some other natural remedies that we came across were coconut oil, as we said, walnut oil, jojoba, aloe vera, vitamin E suppositories. Vitamin E suppositories are interesting. They stimulate the vaginal mucosa, which lubricates the vagina and helps prevent infections. So can't get any safer than vitamin E in terms of something that can help untoward symptoms, decrease bacteria counts, and really, really help. Well, let's think of some other natural remedies besides what we can put on the area. Natural remedies for vaginal dryness and atrophy. So that atrophy, again, is that inflammation, the dryness, and the thinning of the vaginal walls. So what can we do naturally? Exercise. Exercise helps relieve dryness because we're actually increasing blood flow to the cells that lubricate the walls. Smoking. Let's give up that tobacco. Smoking decreases estrogen levels and increases the risk of vaginal atrophy and dryness, as well as osteoporosis. So let's put those cigarettes down and let's get another habit, maybe chewing on celery. Staying romantically active or sexually active. When we're romantically active, it stimulates and increases the blood flow to the genital organs, which in turn keeps them healthy. This is all about health. When we avoid perfume products such as feminine hygiene perfumes, sprays, and powders and deodorants, these have a lot of chemicals that irritate and dry the tissue. Ever, never should we use douches. Absolutely not. It creates an upside down milieu in the canal and is not needed and not wanted in any form. So, as we talked about last time, when our hormones begin to go in flux, some different things can happen in the body, but we can balance things back. So what I would recommend, as we talked about last week, is FemHer, which balances the estrogens, progesterones, and testosterones in a natural way. It's not going to be an answer to all answers, but it certainly is a help. DHEA ART. Most people in their menopausal pursuit decrease their DHEA, which is made in the adrenals that sit above the kidneys, and those also put on natural sexually hormones. So we want to stimulate naturally the organs that we're producing for us. Adrenal balance. What I love about adrenal balance, as in FemHer, but adrenal balance in particular, has a total surge of adaptogens. Well, what are adaptogens? That sounds like a really weird word. Adaptogens mean if your hormones are too high in a certain area, because there are 7 to 10 hormones, estrogen, progesterone, testosterone, SHBG, pregnenolone, E1, E2, E3, and the like. If they're too high, or whichever ones are too high, it wants to pull them down into the normal range. Whichever ones are too low, it wants to pull them up into the normal range. So adaptogen is just a big word that means it helps hormones adapt. Too high, bring it down to normal. Too low, bring it up to normal. So that's the adrenal balance. And last but not least, the probiotics, pre-probiotics. Prebiotics, fertilizer for probiotics. Probiotics go into the gut, rebuild the lining, and feed the entire body with good bacteria and yeast. So, like and share to be entered for a drawing for a bottle of Adrenal Balance. We'll be drawing that for next week, and we'll announce it on next week's video. Last week's winner was Lynn LeBlanc. So Lynn, you've won yourself a FemHer supplement bottle, and let us know when we can bring it to you, or if you can come pick it up. If you've missed any of our past webinars, they can be found on our YouTube channel, Dr. Burkenstock Skin Body Health. It's always a pleasure to talk to you guys about anti-aging, skin health, body health, and bringing you the best quality of life. You look as good as you feel, and you feel as good as you look. Right now, our Feminine Dryness collection of DHEA HRT, Adrenal Balance, FemHer, and pre-probiotics, which retails at $250, is on sale right now for $199. We're going to hold that sale until Christmas, so $199. Let's get you back to your best sexual health, your best female health, and let's get you back to feeling young again. I'll open the floor if there might be any questions.
What do you suggest about silicone lubricants?
Silicone lubricants, they're not all bad, they're not all good. I like silicone topically, like for scar repair, Topically, silicone internally, it's got some mixed risks and benefits, and I think the school's still out. I don't think it's overly harmful, although when given the opportunity, natural is best.
If I'm premenopausal, can I still take these supplements?
If you're premenopausal, sure, you can still take these supplements if you're having any of these symptoms. If you're having no symptoms, no reason to supplement. But by all means, always talk with your physician before starting any program. We're happy to help or answer questions at any time for anyone who may need us. Okay, thank you so very much for tuning in. We'll be back next week to talk with you some more. I'm Dr. Burkenstock, and it's been a pleasure talking to you about feminine dryness.